So it's been an amazing time for me to come into the commission. We're just
Welcome, Monica. How are you?
I'm very well today, thank you.
First of all, thanks for your time and thanks for agreeing to be involved at our upcoming conference. I'm so glad to have a voice like yours to be on the panel and having that important conversation. I want to get to know more about you, yourself, and your department, and please share a bit more about yourself and what you've been doing.
So my role is a Deputy Commissioner at the WA Mental Health Commission. So the WA Mental Health Commission actually differs a little bit from other commissions throughout Australia because we actually have the remit around delivering the mental health, alcohol and other drug services for the state, whereas that remit is actually sits with other areas in other states. So we're quite unique in that, and which makes it actually critically important that we have a good understanding around what the sector needs, but that we're also really responsive to what's actually occurring, not only in our own Department of Mental Health, but also understanding what the other government departments and sectors are actually experiencing as well in order to respond adequately. So it's been an amazing time for me to come into the commission. We're just at a point by which our last strategy is nearing completion, so our last 10-year strategy. And so we're in the development of our new 5-year strategy, which will come out for further consultation shortly. So it's a really quite an amazing time to be involved with mental health and alcohol and other drugs. And what we're seeing now is from our last consultation that we're actually hearing that some of the things that have been done already have actually really already made an impact as well. So it's been really, really positive to talk to communities who are actually saying it's not everything that is a gap now, but there is sort of absolutely some room for other things to be progressed more than they have been to date as well. So clearly with the last election, we now have 2 ministers as well. So a change in what was the Minister for Mental Health. Now we have an additional minister, which is the Minister for Prevention. So which has been really highlighting what the importance is of ensuring that we're having a preventative approach versus actually just looking at services that are down the track for mental health and AOD. So it's been a big change for us, but a really positive change, which will actually see us clearly have a more focus around prevention going forward as well.